Good afternoon. This weekend was the Memorial Day holiday. It was a time to honor the memory of those who made the ultimate sacrifice for our country. And even though we couldn't hold the traditional large ceremony, many of you still found way to pay your respects in your own way. This was also a great weekend in the fight against COVID-19. Including today, we've had 3 days in a row with 0 new cases. 0. Thanks to your efforts, Hawaii continues to lead the country in controlling the outbreak of COVID-19. And with the low number of cases, we are moving to reopen our economy. But it must be done in a careful manner so we can continue to protect your health and the health of your families and neighbors. As the state continues to reopen, we know that childcare is essential. Without a safe place for their children, many people who have a hard time returning to work. Childcare services that served essential workers remained open during the COVID-19 crisis. And my 8th supplemental proclamation authorized all remaining childcare facilities to reopen. To assist in reopening, the Department of Human Services is releasing new guidelines and contract opportunities for child care facilities and providers. The new guidelines will utilize all available public health guidance from the Centers for Disease Control and Prevention and the Hawaii Department of Health. Our goal is to minimize the risk to children, staff, and families when resuming or continuing child care operations. The department is also announcing contract opportunities for child care facilities, as well as requests for proposals for child care providers. These opportunities will support families and provide an injection of funds to help Hawaii's economy. With me today is DHS Director Pankaj Bano and our Economic and Community Navigator Alan Oshima to provide information about the new guidance and contract opportunities. The reopening of Hawaii is moving forward. Stores are reopening. People can go to the beach and some parks. Some services and other businesses have restarted. I expect to announce the end of the inter-island travel quarantine very soon, and we are finalizing the plans to reopen tourism. Now the key is to make sure we keep COVID-19 under control. We need to monitor the reopening, and I want to assure you that if any outbreaks occur, we are ready to jump on them. We have the hospital capacity to treat those that are affected. We have contact tracing capacity, and we are training more contact tracers every day. And we have the testing capacity to test all close contacts. We are ready to respond, but it is important to remember that the way that we will keep the virus under control is through personal responsibility. It's about your own actions. This weekend, most of you enjoyed the holiday in the right way. Small gatherings, physical distancing, wearing your masks. But some people decided to ignore our health guidance. I'm sure you've seen the reports about large gatherings at the beach that required intervention. One incident had nearly 200 people gathered together. Simply put, this was not smart. I know the shutdown has been hard on everyone. Everyone wants to get outside and socialize, but we need to reopen in a smart way. Everyone in Hawaii has done a great job in coming together to flatten the curve, and we have sacrificed too much to have the health of our community threatened by the actions of a few inconsiderate people. We expect an increase in new COVID-19 cases as we reopen, but still, we need to be careful. As I've said before, if a new surge occurs that threatens our healthcare system, we may need to reinstate some of the restrictions. So I encourage you to enjoy the reopening of our community, but we still need everyone to keep our health measures, maintain physical distancing, wash your hands, wear your masks, stay at home if you feel sick, and avoid large gatherings. We came together as a community to fight the virus, and we still need to work together to remain safe. So please take care of yourself, take care of each other, and most importantly, take care of our community. Thank you.
Thank you very much, Governor. And our next speaker is Alan Oshima, Navigator, Economic Recovery and Resiliency.
Thank you. Thank you for asking me to be here, Governor. It's really a pleasure to be here with the Department of Human Services. Early on in the Navigators, about a month and a half ago, in reopening the economy, we always recognized that good, reliable child care would be needed for employees to safely return to work. DHS developed the guidelines that you're about to hear about today so that all of our parents, our children, and our families can feel secure about the good child care that will be available as people return to work. The final guidelines were released by the Department of Human Services today. They represent a collaborative effort between government, DOH and DHS in particular, and the private sector, private child care providers, and businesses. These guidelines were designed with input from the Center for Disease Control and the World Health Organization, as well as practices gathered from other jurisdictions across the mainland. But in the conduct of the preparation, it was very interesting to learn that Hawaii is leading the nation in developing these guidelines. We surveyed all of the states to see what other guidelines were available, and ours are the most complete to date. There were many individuals and organizations involved. I'm not going to name all of them because it's too long a list, but I want to pay special attention to 3 state employees who did an admirable job in pulling together the private sector and other providers to come up with these guidelines. They are Dana Balansag, Child Care Program Administrator at DHS, Lauren Moriguchi, Director of State Executive Office on Early Learning, and Representative Linda Ichiyama, who quickly volunteered to guide this sector as part of the Navigators staff to come to a conclusion. And we really appreciate all of her good work. The guidelines also include detailed reference material that will enable child care providers to effectively implement the new guidance. They include cleaning and sanitation and safety measures, child and parent expectations, employee support, physical distancing, limiting child care groups to 9 plus 1 teacher, room dividers, staggered meal times, health and safety temperature checks, face masks, physical distancing to the extent possible, and facility safety, ventilation systems, trained backup staff, communication protocols, etc. I am confident that with these guidelines, we can all feel confident in leaving our keiki with qualified child care in the state of Hawaii. Thank you.
Thank you very much, Mr. Oshima. And our final speaker is Pankaj Banot, Director, Department of Human Services.
Thank you, Governor. Thank you, Alan. Childcare guidelines for reopening or continued care are based on the CDC, World Health Organization, Department of Health, and many other organizations across the nation. These are the best practices so far in the country when it comes to providing childcare during this difficult time. Special mahalo to Alan, Dana, of course, Governor, and Representative Ichiyama and many other stakeholders across the childcare communities for their hard work on getting these guidelines out. These guidelines include 3 fundamental elements: cleaning and sanitization, physical distancing, health and safety of children and staff. These guidelines also address safety of facilities, child and parent expectations, certain communication that must be provided or must be put in place for families and those who come in contact with these facilities. Also, employee support during this time is very important. We are also going to issue, we have issued the RFP seeking proposals to enter into contracts with the childcare providers. The total amount available for this particular RFP and contracting is $11.9 million of childcare and development block grant that State of Hawaii received through the CARES Act. This particular effort is exclusively focused on stabilizing and supporting childcare providers across the state. The licensed or registered childcare providers and providers who are contracted by the Department of Education for their A+ program are eligible to apply. The deadline to apply for this particular RFP to submit proposals is July 31st, 2020. The funding is for the purposes of cleaning and sanitation and other activities necessary to maintain or resume the operations of childcare programs. Our childcare program office and licensing staff statewide are standing by to support our childcare providers throughout this pandemic and beyond. For more information, you can visit our website at humanservices.hawaii.gov. Thank you.
Director Benoit, would you please stay right there? We're going to continue now with our question and answer, and we'll do the first question for you. This is